Hello, my name is Melanie Windsor. I'm going to be interviewing you today. Thank you so much for taking the time out to come and answer my questions. So, can you introduce yourself to the camera?
Angelina Rivera. I am a registered nurse, registered respiratory therapist, um, certified asthma educator. Um, I'm a community healthcare worker. In addition to that, I'm also a cystic fibrosis educator, and I also educate sickle cell children with sickle cell disease.
Okay, so can you explain your credentials for us?
Well, I'm sure you know what a registered nurse is. That basically speaks for itself. I also work in the pediatric and the adult sector. I've also worked in home health care as well. Um, I also have a dual degree. I am also a respiratory therapist. A respiratory therapist, we basically educate um, people with pulmonary diseases. We basically are over the entire cardiopulmonary system. I treat people with asthma, bronchitis, any type of respiratory failure. That's what I do. That's what I handle. We also we intubate. We basically we initiate ventilatory support. As an asthma educator, I basically go out and I educate people with asthma, try to get them to recognize their triggers, manage their disease. Lots of preventative resources I hand out. I talk to them about the importance of using spacers and aero chambers with their inhalers. I wish I had one with me. Basically, a spacer is a little plastic device that you use along with your inhaler, and you place your inhaler inside of it. You basically put your inhaler in your mouth with a mouthpiece if you're an adult. If you're a child, you're going to put the mask over the child's face with a very tight seal, release the inhaler, take a big deep breath, hold your breath for about 30 seconds, and exhale. And this is very important. A lot of people don't realize it because without that spacer, 75% of that medicine is going to be lost in the cheek or the back of the throat.
Oh, wow.
I basically educate adults with COPD. COPD is a chronic lung disease that usually occurs with our older population. It's going to be chronic bronchitis, emphysema, all types of pulmonary disorders, and there are no cure for them. And basically, with the COPD, the purpose and goal of my preventative care with these individuals, there's no cure for it, but it's to help them manage the disease with proper diet, the risk of continuing to smoke. I basically try to encourage them to have a better quality of life,
Okay.
to basically try and reduce their symptoms. And if I can control those symptoms with my preventative tips and services, it will reduce the number of exacerbations as well as asthma. With my asthma clients, I basically try and talk with them um, about controlling their triggers and basically trying to eliminate some of the triggers.
Mm-hmm.
Um, as a community health worker, my community health worker, basically, let me back up a bit. With my respiratory therapy and my registered nurse license, I actually had to go to school and get a license. My other credentials and certifications I have, that was basically credentials I got on my own, and there really wasn't school involved. It was more so like clock hours courses.
Mm-hmm.
And basically, I felt that by me doing this, it would enhance my patient advocacy and um, my preventative healthcare programs, because I would actually have the certification and I would have the information that I needed and the tools I needed to give my clients.
Okay.
And as a community health worker, pretty much you are a liaison.
Right.
You know, I go out into the communities. I target low-income communities, basically children that live in very, very impoverished areas where I know that most of the time the parents are on Medicaid or CHIPS and they don't have the transportation needed to get to the doctors and the physicians. We go out there, we bring toothbrushes and we give them toothpaste and encourage them to have dental visits, to keep their teeth clean. We give them that as a reward for listening to us, giving them handouts. We, as an advocate and as a community health worker, I point the parents in the right direction as far as nearby health clinics, affordable health clinics if they don't have any insurance. We give them tokens for the bus, vouchers for taxi cabs, whatever. Usually, what prevents people from seeking out the proper health care or nutrition services, the main excuse they have is, well, we have no transportation. We don't have a way to get there. It's too far. But by doing this, we're eliminating the middleman. We're like, okay, well, we'll give you bus vouchers. We'll give you a voucher to take a taxi.
So you seem to be a very important part of the respiratory sector of the medical field. How long have you been doing what you do?
15 years.
15 years? Wow. Of preventative health care?
No, as a respiratory therapist and as a registered nurse, what basically, I guess I can say I've always been an advocate without being an advocate, because once you're involved in healthcare and if you truly care for your patients, you're already an advocate. You're going to make sure that when they come in, they're doing their follow-up care, that they have their medications. If they don't have their medications, it's up to you as an advocate to call social services to see if you can get some type of assistance. If they're not on Medicaid, to try to get the social worker to approve them for Medicaid. If they're in a place where there's mold, as an advocate, you're going to try to get in contact with different community services to either get those parents in a home that is not mold infested, or to try to get them basically involved with someone that's going to remove that mold out of the home. You know, environmental services is really, really a key to preventative care. Making sure that your environment is up to standards, because those type of things, they trigger diseases. You know, they trigger exacerbations. And when I mean exacerbation, basically an exacerbation is an event that's basically brought on by triggers when a person has a chronic disease. And most of the time, an exacerbation is an acute response to a chronic disease.
And is this why preventative health care is so important?
Yes, preventative health care is extremely important because of this. Okay. If you can do preventative health care, preventative is the proper nutrition, taking care of yourselves, eliminating the triggers. Doing these things are going to improve the quality of life. It's going to keep down the costs of healthcare, hospital bills, costly expenses to the families.
Okay. And so do you now charge for your advocacy services?
My advocacy services are done on a basically, I don't want to say pro bono, but we don't do it. We do it for free. Okay. It's basically our community service and giving back to the community. But as a healthcare worker, I mean, you're an advocate anyway, but no, I don't charge for my services.
Okay. And do you work more with adults or children?
I'll say 75% more pediatrics than adults.
With children?
Most of the time with adults, that's going to be where my volunteer services usually come into play.
All right. Well, those are all the questions I have for you. Thank you so much for taking the time out to talk with me. Take Jonathan.